I'm student Miss Young, and today we'll be administering medication to a patient. But before we proceed to our patient, I'd like to review the 3 major checks and the 5 major rights of administering medication. So let's begin with the checks. The first check is when removing the medication from the storage unit. Our patient, Mr. James Henry, has been prescribed an antibiotic. So this drug is not a stock drug. It's ordered by a doctor from the inpatient pharmacy. So you're going to compare the information in your patient file to that of the packaging. You're looking at the patient's name, you're looking at the expiration dates on the packaging, as well as if it was tampered with, or if it was opened before, the date and time it was opened. Next check is when you're going to remove the medication from the packaging, and the final check is when returning the packaging to the storage unit. Now let's go into the rights. The 5 major rights are the right patient, the right drug, the right dose, the right route, the right time, and frequency. When you're going to check the right patient, you're going to use 3 identifiers: their first name, their last name, as well as their date of birth. You're going to confirm the right patient by introducing yourself to your patient, asking them to verbalize the 3 identifiers, and comparing this information with that in your patient file. In your doctor's notes, you will see the name of the drug, the dose, the time, the frequency, as well as the route. Also, you would want to check your nurse's notes, your nurse's medication record, to see if the drug was administered and when it was, because you don't want to overdose your patient. So you check that as well. So now that we have gone through the major rights, and bear in mind, your patient has the right to refuse. Just want to add that in there. So whether your patient refuses or accepts to take the medication, you still have to record this, because if it wasn't documented in our profession, it said that it isn't done. Documentation is very important, and we document after the task has been performed. So let's go and administer our medication to our patient. We're going to administer our medication to our patient. I have my patient medication file here. For the information is Mr. Henry James, so we're going to go and talk to Mr. Henry now. Hi, good morning. So how are you this morning?
Okay.
I'm student Miss Young, and I came to administer your medication this morning, right? So can I see your ID gun? What's your name?
Henry James.
Right, and your date of birth?
10/31/51.
Okay, thank you, sir. So, Mr. Henry, do you have any known allergens?
No.
Okay, so your doctor prescribed 8 milligrams per kg of amoxicillin for you every 8 hours, right? I'll give you a little history about the drug. It's an antibiotic. It just came out of surgery, and so just to make sure you don't obtain any bacterial infection, he administered this medication. It's antibiotic, right? So it treats a wide variety of bacterial infections, and there are not really much side effects with amoxicillin. The only thing is some people have gestational upset that manifests itself into diarrhea, vomiting, and nausea, and you have more major side effects such as a rash. Now, if you develop a rash, that means you have an allergy, right? You're allergic to it, and you need to tell your nurse or your physician immediately if this happens.
Yeah.
So, knowing all this information, would you be taking the medication today?
Yes.
Okay. So, I have the informed consent, so I'm going to proceed. Do my hand hygiene. Checking my patient folder, medication. So here we have Mr. Henry James, amoxicillin, checking back, right? Says on the bottle it's 500 milligrams, right? The expiration date is the 10th of the 12th, 2023. So we're good. They're giving him it every 8 hours. And when I check my niece's records, nobody has given him yet for the morning, so we're good to go. So with antibiotics, you give it according to the patient's age as well as their body weight. So we already worked out the calculation. We know it's 1 tablet that we are prescribing. We are giving our patient, Mr. Henry. Right, and we perform our hand hygiene. Right, 1 tablet. Put the medication into its packaging. Right, so we're going over here to give our patient, Mr. Henry, his medication. So you can put on your mask. Put the medication in your mouth. You can have some water. Nice. So the reason why we are using water is because some fruit juices and dairy products as well as alcohol will affect the way the drug is absorbed into the body. It is important that we finish the course of the treatment as stipulated by the physician, because with antibiotics, if you don't continue the way you're supposed to, it could develop a resistance to the medication. So that means next time when you get an infection, this medication will not work. We're going to have to prescribe something else for you. Right? As well as the process of your healing process will be reversed, because if you stop your medication because you're feeling good, let's say after 3 days, the bacteria will continue to grow and infection will return. Alright, so it's important for you to finish out that. As I mentioned before, if you're experiencing any diarrhea and you see any watery stool with blood in it, either with stomach cramps or fever out, you need to tell your physician. You've seen any rash, redness, swelling, you need to tell your physician or your niece. Right?
Okay.
So, now that we've finished administering Mr. Henry's medication, we're now going to document what we gave. So we put the date, it's the 17th of the 12th, 2021. We put the drug, amoxicillin, the dose, 8 milligrams per kg, which is equivalent to 1 tablet, and it was given orally. So we have the date, the name of the drug, the dosage, and the route. And then I will sign off. So as you can see, everything is documented. This is the nurse's medication sheet. Date, the time, the drug name, the drug dosage, the route, it's orally, and I signed Samantha Young, series student nurse. And that's it.